Good afternoon, everyone. My name is Io Taylor, and I'm here on behalf of the California Primary Care Association. CPCA member clinics and health centers totals 1,276 sites across California. That is over 7.7 million patients, 1 in 5 Californians, and 1/3 of the Medi-Cal population. As of January 1st, 2024, the loop has finally closed. Income-eligible individuals ages 26 through 49, regardless of immigration status, became eligible for Medi-Cal. Today, we are here to spread that information about the largest expansion in healthcare coverage since the ACA, and that's Health4All. The people that are here besides me on stage have dedicated their career and life's work to advocate for equity and access for the communities that they serve. Our first speaker, Michelle Monroe, was appointed CEO of One Community Health in January of 2020. With more than 18 years of progressively responsible operations, organizational strategy, and finance revenue cycle leadership in community healthcare and rural health. Without further ado, let me introduce Michelle Monroe.
Thank you, Io. So welcome to One Community Health. For those of you that are not familiar with One Community Health, we started in 1989 as an HIV specialty clinic servicing over 3,000 individuals living with HIV here still today in this community. As an FQHC, we are here to see all people, regardless of their ability to pay, their insurance status, their immigration status, their conditions, their demographics. And last year, in total, we saw over 18,000 individuals here. Here at our Midtown campus, also in partnership with Wind Youth Services, who's here today, down the street on S Street, and at our location in the Arden area here in Sacramento. The demand for services in Sacramento for healthcare is very, very great. And with this Midtown campus, we're going to be expanding into this building here and creating even more health center space. Thank you. And also a new location in the Arden area to provide even more access. Many of our patients are covered by Medi-Cal, but many are not. A lot of patients to date, until January, had no options. They were uninsured. So we are here happy today to get the word out about Health4All, Medi-Cal coverage for all California residents regardless of immigration or age. As a health center, we take great responsibility in managing the health care of our patients. As our patient's primary care provider, we are responsible for the coordination of care inside and outside of our walls. When a patient does not have insurance coverage and they need services outside our walls, it's very, very difficult. I've been working in community health centers for over 20 years, and I cannot tell you how many conversations I and others have had with patients and their family members who had no options for coverage and they needed care. They needed treatment, they needed surgery, they needed diagnosis, and they had no options. And for those that had serious, very serious health conditions they could not pay for, it was made even worse. Health centers like One Community Health have been faced with these challenges for years. How do we help patients who have no options to pay for their services, for the care they so desperately need and deserve? Care, if they did not receive, sometimes unfortunately does end in death, if not suffering. Health centers have partially filled that void with expanding our own services and providing extensive primary care services, dental, behavioral health, and even going into the specialty services that we do provide regardless of a person's ability to pay. However, many patients need care beyond our walls, and Health4All literally opens the door for patients to be able to have access to that care now. Looking back at those difficult conversations with patients, we stand here today with progress, knowing that access to Medi-Cal is no longer a barrier. While there's much more to be done with our healthcare delivery system, Health4All is a strong and needed step forward in improving health inequities and the health of our community. Patients can access Medi-Cal application services and education through One Community Health and through other partners here in Sacramento, including La Familia and Community Health Works, who are here today. They have certified enrollment counselors that are available to help our community members with education and Medi-Cal applications. So thank you for being here and for spreading the word that Medi-Cal is available to all, regardless of age or immigration status. Thank you.
Thank you, Michelle. Our next speaker is the president and CEO of the California Primary Association. Mr. Silva is a healthcare executive with over 18 years of leadership experience in association advocacy and advancing access to healthcare. Ladies and gentlemen, welcome Mr. Francisco Silva.
Good afternoon. Yes, good afternoon. It's certainly a moment of celebration. My name is Francisco Silva. The California Primary Care Association represents the community health centers and clinics, as well known in many communities across the state. That's a key component of our healthcare system. We serve 1 in 5 of all Californians. 1 of every 3 Medi-Cal patients gets care at a health center. One of our core missions since the inception of the community health center movement was that healthcare is a human right. Can we hear that? It's a matter of dignity. It's a matter of dignity for our people. It's a matter of dignity for our community. And we are on our way. The community health center model was started out of the civil rights movement, when people came together to address the needs of our communities. And there were many, from civil rights to healthcare to access to education. That was the birth of health centers. And at a time where there were mostly all entirely free clinics. There was no funding, but the community came together to find a way. And over time, the people that we can see and the support for them has grown. On a personal note, this means a lot to me. I am an immigrant myself, a child of farm workers, and I remember coming home, my dad's finger was almost cut off, hanging. He didn't go to the hospital. He wasn't picked up by the ambulance. Why? Because the concern was cost. The concern was, can we do this? We're barely making it. Health4All provides that dignity for people like my dad and my family to get the care that you need, to get the service that they absolutely need to survive and for their family to thrive. So I want to personally, on behalf of myself and my family and all the health centers in the state, thank Commissioner Lara, who led this effort in partnership with the California Endowment, who decided to make this a campaign that we can get this to be a priority for our people. So, great moment to celebrate, and thank you for your support for being here.
Thank you, Francisco. Ricardo Lara has been a champion for healthcare for all Californians in the legislature and now as our state's insurance commissioner. He authored the first Health4All Kids bill that expanded Medi-Cal coverage to every Californian under age 19, regardless of immigration status. He has continued to work hard so today all Californians can have health coverage. Welcome, Commissioner Lara.
Thank you. It's great to be here to mark this momentous occasion. I also want to thank my compadre, Assemblymember Kevin McCarty, for being a massive supporter in the legislature as we continue to fight these battles about healthcare for all. You know, I spent my career first in the California legislature and now as California's insurance commissioner, fighting for the right for every single California to have equitable, affordable, and complete comprehensive coverage, regardless of how much money you make, what language you speak, or where you were born. And I want to start by saying a simple fact that Francisco said already. We all have the right to health care in this country and in this state. There is a reason we call it Health for All and not health for some. My personal experience as Francisco as well, you reminded me, Francisco, of my own family drama and trauma of not having health care. Was witnessing my own parents argue about how they were going to pay their health care bills when they were undocumented in Los Angeles. That was the fuel for changing how we talk about health care in California. Health care is absolutely a right and not a privilege for just the wealthy few. That is why I proudly authored Health for All Kids, expanding full-scope Medi-Cal for every child in California, regardless of their immigration status, and together with the Latino caucus in California, doubled down our efforts to make sure we got to this day, to this exact moment in time where every single Californian, regardless of their immigration status, have access to full-scope Medi-Cal. And this is actually a promise kept for the numerous children. You know, when we got Health for All Kids, we went up and down the state signing up children. And as we spoke to their families, the kids would often pull me aside and ask me one question. Thank you for getting us health care, but what about my abuelita? What about my dad? What about my mom? And so today, everybody on this stage is fulfilling that promise to those young men and women who asked that very question. And you know, it's really actually sad that these kids were actually worried about health care when they should be worried about their homework, playing, recess. But that is the reality for so many of our families in which everybody comes together to figure out how we're going to get access to health care. You know, I also want to give a shout out to our governor, Gavin Newsom. We would not be here without the governor's leadership in signing the Health for All budget bill last year. And I can safely say that there's no other governor that has done what he's done for our immigrant communities, especially now more than ever when it actually matters and we continue to be under attack. Let's give him a round of applause. And as we're celebrating today, we also know that our Asian, Black, and Latino Californians still are 2 out of 3 times more likely to be uninsured. Because of our work, we can probably say that all Californians have access, but we need to do a lot more work to get people actually enrolled. So as we celebrate today, as we celebrate the access that we have to turn that access into action. And that's what we're doing today. Because Assemblymember McCarty could tell you that if we don't use the programs that we establish, if we don't get the numbers and use the resources, they're going to be taken away and used for something else. And that is why it is critical that we not only partner with the Primary Care Association, but that we do this around the state to remind people that we have to do what we do best. Talk to our neighbors, talk to our family, get our folks enrolled. So not only do we show critical numbers, we demonstrate that there is a tremendous need out there for access to care. And we know it. You all live it every day here. And so I'm proud to be here, proud to be part of this 10-year endeavor. and to tell those children that we got coverage for your abuelita, your tío, your mom. Now go out there. Let's subscribe these folks, as many as we can, and fulfill that promise that we made 10 years ago to those kids, that we now, once and for all, have full access for every single Californian. Thank you so much.
Thank you. Thank you, Commissioner. Our next and final speaker represents the 6th Assembly District, including the majority of the city in Sacramento and parts of the unincorporated county. And he's also an alumni of the great El Camino High School local, here in Sacramento, California. Join me in welcoming Assemblymember McCarty.
I have a feeling that you also went to El Camino High School. Yes. Yes, I have the pleasure of representing One Community Health in Sacramento in the State Assembly, and it's my honor to be out here today as we recognize Healthcare for All Week and the work that we're doing here in Sacramento in the state of California. And Insurance Commissioner Lara is correct. We've taken great strides in the past 10 years to make sure that healthcare is a right and not a privilege. You know, we took steps to make sure we focus on everybody who doesn't have documentation as far as kids, then seniors. For the people in the middle, we took a huge step in the last few years and funded it in the budget. But those are all words on paper. Those are all votes that don't make sense unless us and you and all of us focus on the community to help people sign up. So that's incumbent upon us to make sure that everybody has the opportunity to go see a doctor, take care of their families, because health care for individuals is good for California, it's good for our economy, it's good for the future of our great state of California. So yes, we voted on these laws. Yes, I was proud to support these as a member of the Budget Committee. Yes, I voted for them as a member of the Health Committee. Yes, I voted for them on the Assembly floor. But now it's our work to make sure we sign up every Californian who's eligible to get health care. And the community clinics, I love that statistic, have a huge role in this. 1 in 3 Medi-Cal lives, I always forget that. And that's just a reminder that, you know, we always hear about the big healthcare systems. I'm certainly part of one. But people throughout our state more likely to have a community healthcare clinic that's right there in their neighborhoods. So thank you for your work, and onward we'll make sure we have healthcare for all in California.
All right. If we can just thank Michelle, thank you for hosting us this afternoon. If we can thank the One Community staff. I know this took a lot of time and effort, so thank you. This concludes our press conference. Thank you all.